Hi, Dr. Raj here, and I want to talk about the management of insomnia. And you know what? We are not going to include FDA-approved prescription medications. So, of course, I have to say one thing first. The cornerstone therapy for the treatment of insomnia has to be cognitive behavioral therapy. And anything I do after that will always be added to my strong base of CBT. So I want to focus on three things today. Number one, it's going to be dietary supplements. And what are some examples of dietary supplements? It has to be valerian root, tryptophan, magnesium, and of course, melatonin. What is the downside or the big question mark with any dietary supplement? What dose, what route, what form, what type, and is there evidence-based medicine behind it? The next category I want to talk about has to be over-the-counter medications, things you don't need a prescription for. And of course, the two Ds jump to my mind. Number one has to be diphenhydramine. Of course, everyone calls it what? Benadryl. The other is doxylamine, and you can get that when you purchase things like Unisom. And when we talk about these early generation antihistamines, such as diphenhydramine and doxylamine, that's why they make you sleepy. Histamine is an alerting neurotransmitter, so if you block it, you do get on the sleepy side. But you have to worry about the anticholinergic effects. And when we talk about dementia, if you constantly, chronically take these early generation antihistamines, they put you at a higher risk for developing and worsening cognitive function. So please be careful. The last category I want to talk about are medications that are prescription, but they're not FDA approved for insomnia. And I want to mention four for your sleep medicine board exams. Number one has to be the tricyclic antidepressant called amitriptyline. So not all TCAs make you sleepy. Only certain ones do, and it's definitely going to be amitriptyline. It goes by the brand name Elavil. And anytime you take a tricyclic antidepressant, you do worry about three things. Number one, it's going to be the anticholinergic effect. So you think about things like constipation and dry mouth. You worry about orthostatic hypotension. Why? It has alpha-1 blocking properties, so you got to be careful. The last is going to be the antihistamine effect, but isn't that what you want? You want to be a little sleepy. So what is another medication that we use that's not FDA approved for insomnia but makes you sleepy? You know, I have to mention trazodone. It goes by the brand name Desiril. And when I think about side effects, I have to mention priapism. It's not common, but I still want you to know about it. If you ask me what is the mechanism of action, it's called a SARI, S-A-R-I. It's a serotonin antagonist and reuptake inhibitor. The third drug I want to mention is mirtazapine. It goes by the brand name Remeron. How does it work? It's a tetracyclic medication, and people use it for an appetite stimulant, so you can get some weight gain. And its brand name Remeron has a little story behind it. It actually does not affect REM as much as other medications do, so it's called Remeron, REM on. And the last one has to be quintonapine, goes by the brand name Seroquel. It's an atypical antipsychotic. It's used quite frequently in the hospital. Even when I'm wearing my critical care hat, it's almost like you can't leave the ICU without getting a little Seroquel. So it is a sedating medication. It does have antihistamine effects. And of course, be careful because it does prolongate the QT interval. And those are my pearls for your sleep medicine board exam.